You know, kids with cancer are kids after all, so it's a lot more of a difficult situation than when you're dealing with adults. So Dr. D, talk to me a little bit about how treatments for cancer have changed in the past 30 years. What's been kind of the biggest breakthrough? Have we rewritten the medical books on this?
Oh, absolutely.
Yeah.
What I usually say, I mean, I started my training in the early 80s, and I think there is no field in medicine like the oncology field that experienced that huge leap in the last 30 years. And I can explain it by a few phases. The first phase in the 80s was the molecular biology technique. We had technique developed at that time that made it very easy to look into something we call DNA or RNA and use it for research. The second phase, it was in the era of President Clinton when he decided with the NIH they need to map the human genome. Imagine 1992, 93, we didn't know what is our human genome at that time. So it took so many $1 million, so many years to put that human genome together, and that was the beginning of the genetic revolution. And 10 years, 15 years forward, things are just amazingly advanced. I was sitting this morning at the Miami Cancer Institute, what we call it molecular tumor board, and I made a comment. I would like to repeat it now. What I said is that the molecular biology technique and the genetic studies that we have right now is far ahead of us as a clinical oncologist. We have a lot of information, thousands and thousands of abnormality in the gene of cancer that we're really still trying to scratch our head and say, how are we gonna deal with it? But that's the future of curing cancer 10, 20, 30 years from now. This is what has been happening in the oncology field.